Hi, we're going to be talking briefly right now about substance abuse and seniors. Now, abusing drugs or alcohol is dangerous for an individual at any age, but the elderly population is at greater risk for certain complications and adverse events due to physiological changes that occur with aging. According to the American Society of Addiction Medicine, ASAM, the elderly, cachectic, or debilitated patients are more likely to experience respiratory depression and constipation. According to drugfree.org, between 1997 and 2008, the rate of hospital admissions for conditions related to prescription medications and illicit drug use rose by 96% among people between the ages of 65 and 84. For people 85 and older, admissions grew 87%. Elderly patients who misuse or abuse their prescribed medications are increasing their risk of dangerous side effects, such as drug-induced delirium or dementia. SAM-HSA points out, yet the non-medical use of prescription medications continues to rise in the older adult population. What we're going to talk about briefly here is the signs and symptoms of substance abuse. They can be easily confused with symptoms of comorbid conditions. Family members, for instance, may assume symptoms such as memory loss are resulting from progression of Alzheimer's disease, when in actuality they're being caused by misuse of medications or adverse drug interactions. Potential risks of drug or alcohol abuse and or addiction for seniors creates an increased sensitivity or decreased tolerance. Less substance produces a stronger effect. Higher blood concentrations due to slow metabolism. There's a risk of accidents, falls, injuries, excessive daytime drowsiness, disorientation or delirium, significant memory problems, slowed respiration, worsening liver disease, cardiovascular disease, or diabetes, sleep disruptions or disorders, ulcers and gastrointestinal problems, adverse drug interactions resulting in seizure, coma, or death. When prescribing opioids to elderly patients, physicians often start at 1/3 to 1/2 the typical dose. Elderly patients should also be more closely monitored through the course of treatment. But physicians alone cannot monitor patients continuously, so caregivers and family members must also pay close attention and watch for potential signs of abuse or dangerous side effects. We have some resources that we'll be forwarding to you, and you can check out the website that's related to this material down at the bottom shortly. I want to thank you. Be happy, be healthy,